hitting the start button now.
Good afternoon. Thank you everyone for joining us for this new webinar that we have today. As you may know, we have a brand new health plan. It's called Net CanopyCare HMO. We're really excited that you've joined to learn more about this plan. The reason why SFHSS added a new HMO is because we wanted to offer all of our members not only just more options, but we really felt this was different from the other HMOs that we offer. So we're so glad you've come to learn more. And if you can move to the next slide, I just wanted to tell you a little bit more about how this presentation will work today. So everyone is going to be on mute for the entire presentation. However, we love getting your questions. So please, please, please ask away. All you have to do is look for your menu bar, which may be at the top or bottom of your screen, and click on that little question mark button. That will take you to a live Q&A chat box, and that's how you can ask us a question. And we will be sure to monitor our chat and make sure that we answer your questions today. And if your question's a little more complex, it just so happens HealthNet has one-on-one office hour consultations available that you can schedule, and they're going to provide that information later. And also at the end of this, it's only a fairly brief presentation. We are going to do a live Q&A, and we hope to get through everybody's questions today. So thanks so much for joining, and without further ado, I want to introduce you to our presenters.
Wonderful, thank you, Jessica. I am going to do a little bit of introductions here. So first off, thanks for joining today to learn about the exciting new health plan option available to you and your families, Net CanopyCare HMO. Today's speakers will be Mike Robinson, who's CEO of CanopyHealth, Andrea Kometz, Senior Director of Clinical Operations at CanopyHealth, Jesse Blake, Vice President of Clinical Operations at HealthNet, Terry Esslinger, Account Manager at HealthNet, and myself, Cameron Gazog, VP of Marketing and Business Development, CanopyHealth. We're looking forward to sharing all the ways that CanopyCare can improve your and your family's lives. So let's start by going over the agenda. On today's agenda, we're going to cover CanopyHealth and its Powerhouse network, the member experience, your PCP relationship, second opinions, digital tools, and getting care, which will include information about behavioral health and starting a family. Throughout the presentation, we'll illustrate this with the journey of our fictional members. So let's start with what CanopyHealth is. So many of you who have experienced health systems might know that a typical health plan network is built around contracts between health plans and individual providers. And these health plans usually assemble a network from these contracts. And in a health plan network, it's very seldom that the providers in the network work together on topics like access or quality or member experience. In fact, they're all kind of doing their own thing. So when you boil that network down, it's more of a financial transaction than anything. So our secret sauce, if you will, at Canopy is our ability to bring the alliance partners together, our network, which we'll go over in the next slide, bring them together and give them incentives to work together to improve affordability, access, quality, all geared toward providing you and your families a better member experience. So some things I'd like to feature here are first that we have the best hospitals and medical groups in the Bay Area. When you think about what the best medical groups and hospitals are, many of them include the CanopyHealth Network Alliance partners, which again, I'll go over in the following slide. CanopyCare is really a system of care. So it's not really just a collection of medical groups and hospitals thrown together. It's highly coordinated care delivery. It's a one-stop digital experience. And instead of making it difficult for members to seek care outside of their own medical group, for us, it's really a feature rather than an exception. And then finally, it's important to mention that CanopyHealth is the network that many doctors and nurses choose to seek care both for themselves and their own families. So founded in the Bay Area, Canopy is owned by providers and used by providers. We were actually founded by UCSF and John Muir, among others, who they own us and they founded us and we're native here to the Bay Area. Next, I'll talk a little bit about the CanopyHealth Powerhouse network. So this is our network, 5 very large medical groups encompassing over 5,000 healthcare providers with 23 hospitals. Interesting to know that Chinese Hospital is our latest addition, based here in San Francisco. I really think our alliance partner reputations speak for themselves, but there are a few things that make Canopy Health, the network, quite a bit different from other value networks. The first is our Alliance Referral Program, which allows you or your family to seek referrals for care anywhere in the Canopy Health network, not just your own medical group. So if you normally see a Meritage primary care physician, but you heard from a friend that UCSF has a really great surgery program, or whatever it might be, you can seek a referral without having to jump through too many hoops. Second is the strength of the network. So it's important to note that most other networks, there's usually a way to get to an academic medical center if you really have to. However, it's really unusual for an academic medical center to lead the charge in value-based care and creating a great member experience. Our partner UCSF and owner UCSF is on the forefront and has made a substantial commitment to value-based care through Canopy Health. Third, and I know I've mentioned this already, but it is the network that many doctors and nurses around the Bay Area choose, and some examples are UCSF, John Muir, and Marin Health. With that, I'd like to turn it over to our CEO, Mike Robinson, to talk about the member experience.
Thanks, Cameron, and thanks to all of you who've taken interest in what we're doing and joined us for the broadcast today. Before I jump into things, I'd like to reiterate Cameron's point. The Canopy Health Network is owned and operated by health systems like UCSF, John Muir Health, and medical groups like Health Physicians Medical Group. Our job is to provide access to outstanding health care and support you through an improved member experience. In addition to the broad access to care through physician offices, urgent care, and emergency services, we offer video visits through MyCanopyHealth app. There's no separate login or account setup required. And after you have a video visit, the notes are routed back to your primary care physician, so she is in the loop. With the Canopy Health Network, almost all care decisions are made by the medical groups in our network. This helps us remove unnecessary barriers to care. The plan also features a range of health and wellness programs, plus acupuncture and chiropractic services. Next slide. As Cameron said, Canopy Health is an integrated system of care. It all starts with your primary care physician, someone who knows you and your history. I personally have had experiences with primary care physicians where their services have been invaluable. Recently, my primary care physician saw something a little off with my blood work, and he took the initiative to explore it further, and I'm very thankful he did. He knew me well, but he just saw something that he thought was a bit off. And if I hadn't had a strong relationship with him such that he knew what to look for, it might have gone unnoticed, and I would have faced real trouble down the road. So in addition to serving as a caregiver, your primary care physician serves as your advocate and your coach. Their goal is to get you the right care at the right time in the right setting. Let's talk about one of the more valuable and unique features of the Canopy Health Network. Next slide. Most HMOs limit people to the panel of specialists that are aligned with their primary care physician. So an example would be if you sign up with a John Muir Health primary care physician, in most HMOs, you're pretty limited in terms of your specialist selection. Canopy is different. With the Canopy Health Network, your primary care physician can refer you to anybody, any specialist across the network. Now, I've talked to my team about a San Francisco motorcycle police officer I oftentimes see commuting in from the far East Bay. He's noticeable, obviously, because of his uniform and the motorcycle he rides. But what we know is there are thousands of less obvious city and county workers, firefighters, court workers, teachers, and yes, police officers who commute into San Francisco from outlying communities. As we put it, they need to be able to access convenient care where they live, work, and play. Canopy supports access through referrals to specialty care across our network. Next slide. Here's another example of where easy access to specialty care really helpful. You've been diagnosed with a condition and you'd like to consult with an expert. It's called a second opinion. We highly encourage seeking a second opinion. The Canopy Health Network includes UCSF physicians and faculty, some of the top physicians in the nation, if not the world. Why wouldn't you want access to these top physicians? With the Canopy Health Network, you're able to arrange a second opinion without the hassle. Cameron, back to you.
Perfect. Thanks, Mike. So on to digital tools, and it almost goes without saying that all the standard services are available. These are offered by almost all health plans at this point. You know, searching for your provider, scheduling appointments, viewing lab tests, refilling prescriptions. But what's really unique about what Canopy is doing is that whereas with other plans, you might need to log into several different platforms to access these tools. For example, the John Muir's platform or HealthNet's platform separately. What we're moving towards is unifying all of these platforms into a singular Canopy Health platform. So of course, I encourage all of you to go on right now and look for providers and services. If you're currently seeing a doctor who you want to know if it's in network or not, or if you've had a recommendation by a friend for a specific provider, you can use the MyCanopyHealth app to look that up. Something we do, and I'm just going to move to the next slide here, something we do to illustrate a lot of what we've talked about so far is we like to tell a story. And this story is about John and Mark and their two kids. So John and Mark and their two kids, they live in the East Bay, which is where their PCP is, but they work in San Francisco. They commute in. Mark has an initial consult with John Muir Health. Mark's PCP identifies some abnormalities with his lab tests, and he diagnoses him with a GI issue. Well, Mark decides that he really wants a second opinion about something like this, so he seeks a second opinion at UCSF. After getting that second opinion, his diagnosis is confirmed, and Mark decides to go with the recommendation of the specialist to pursue surgery. Mark's friend had a similar surgery and recommended a surgeon at UCSF. So again, Mark is with John Muir, is referred to a specialist at UCSF, and is recommended by a friend of his to seek surgery at UCSF based on a previous experience. So Mark simply asks for a referral to UCSF using Canopy Health's Alliance Referral Program. And after a successful surgery, Mark has a virtual follow-up appointment, both with the surgeon at UCSF and his primary care physician at John Muir Health through the MyCanopyHealth app. So this story really illustrates how health systems that normally might work within their own medical group and have their own practices can really work together through Canopy Health. It's not, the members aren't circumscribed to one system because of the Alliance Referral Program. Next, I'll hand it over to Jesse Blake to talk about behavioral health and getting care.
Well, hi, everybody. I'm Jesse Blake, and I'm the Vice President of Clinical Operations for MHN, which is HealthNet's Behavioral Health Administrator. I'm going to talk to you a little bit about getting care through MHN. As we all know, being healthy is about mental and emotional wellness in addition to physical health. So we're here to help you out with that. MHN has a network of over 18,000 providers in California, all different kinds of providers. So these might be outpatient providers, they might be facility providers. If you need a higher level of care, it includes, for example, ABA providers that might work with a child with autism in his or her home. And all of this is accessible through MHN by contacting our 24/7 call center. Additionally, for outpatient services, you can literally go to our network, find a provider on the website, and take a look at a provider in your area that you want to see and go ahead and set up an appointment. Earlier, somebody mentioned the idea of reducing barriers to care, and certainly with behavioral health, we try to do that. Some people might be hesitant to seek behavioral health services. Whatever it is, we want to eliminate any barriers that we possibly can. So with that in mind, you do not need a referral from your primary care doctor in order to access behavioral health services. In addition, you can go ahead and see a network therapist or psychiatrist without any kind of authorization whatsoever. You can just go ahead, and once you have the name of somebody that you want to see, go ahead and see them. There's no authorization, no paperwork barriers to worry about it. HealthNet also offers MyStrength, which is a great self-directed support app that has a bunch of different modules for different mental health or substance use conditions, as well as some coping tools like meditations and mindfulness exercises to help deal with stress and other negative emotions. This is available to everyone, and it is a tool that can be used both in addition to behavioral health treatment. And if you're already seeing a therapist or a psychiatrist or both and you want MyStrength, that's fine. In addition, it can be accessed by folks who maybe don't need treatment to the level of seeing a therapist, but just need some tools to manage their behavioral health. So with that, I'm going to stop. But feel free to explore our network of behavioral health providers at mhn.com. Thank you.
Thanks, Jesse. Next, we have Andrea Kometz to talk about getting care and starting a family.
Thanks, Cameron. If we could go to the next slide. It's my pleasure to talk to you about starting a family and what that might look like in the Canopy network. First of all, starting a family can be one of the most exciting times in your life. And at HealthNet and Canopy Health, we know and we celebrate the fact that every family is unique. We want to work with you to make your pregnancy and birth experience a very personal one. If you want to see an OBGYN doctor, you can choose any OBGYN doctor in any one of our 5 medical groups or IPAs, and an authorization isn't needed once you've made your choice. Once you're pregnant, you and your partner can work together with your OBGYN doctor to set up a schedule of prenatal visits, to create a birth plan, to choose a birth center or a hospital where you want to deliver. But if you and your partner are having difficulty getting pregnant, a variety of treatments, including IVF, is available to you. Going through fertility treatment can be mentally and physically challenging, and trust me, I know. But don't worry about that, because we're here to support you every step of the way. Our network is made up of obstetricians who are medical doctors specializing in the care and delivery of moms and babies. Maternal medicine specialists, also called perinatologists, who are specially trained in the care of mothers and babies before birth if things get complicated. And we have certified nurse midwives who are registered nurses with advanced training in the labor and delivery process for moms and babies. Many of our alliance providers offer an array of classes to help you and your family prepare for starting a family. These classes include, in some cases, exercise, laboring and delivering, breastfeeding, infant child CPR, and a variety of support services both before and after you deliver. Some examples of alternative birth plans that can be explored are the Lamaze method, which focuses on controlling pain through breathing exercises, or the Bradley method, which focuses on mom being coached through her labor with her partner rather than a labor and delivery nurse. And of course, with CanopyCare, all of your postpartum or after delivery visits are completely covered. The schedule that you create with your primary care doctor for postpartum visits is entirely your own. Next slide. Thank you. So again, I'm going to tell a story. This story is about Jane and Pooja. Jane and Pooja have been together for 10 years and they feel ready to start a family. They live in Alameda. Their primary care doctor is part of the Alameda health system. So they get their primary care locally where they live. At a gathering not too long ago, they were talking about getting pregnant, and one of their friends, who happens to work at Zuckerberg's San Francisco General, recommended seeing the UCSF Center for Reproductive Health. She says it's the best in the nation. And between you and me, she's right. At the next appointment with their primary care doctor, Jane and Pooja asked their doctor for a referral to the UCSF Reproductive Health Center. Their doctor asked their office coordinator to get that authorization, and before you know it, Jane and Pooja get a message with the okay to make an appointment at UCSF. Once they're at UCSF, Jane and Pooja are supported in a variety of ways throughout the journey to getting pregnant. Each and every one of their options are explained, and those options are from very simple methods to very sophisticated methods. All of that technology was explained and is offered for Jane and Pooja. In a few months' time, they hear the great news that they've been waiting for. You're going to have a baby. Together, Pooja and Jane decide that a midwife is best for them, and that's the way they want to deliver their baby. So they choose San Francisco General's Mention Midwives program, and before you know it, they have a beautiful baby. Once their baby is delivered and they're back at home, Jane and Pooja set up a schedule for postpartum care. Part of that postpartum care includes depression screening. The screening and counseling are offered by MHN's network of behavioral health care specialists. They decide to take advantage of the service, and they are given practical tools and support to adjust to their new life. So in this story illustrates how each family is unique and how the system can work with you to make your birth a personal process. Next slide. Thank you. Next, I want to talk about transitioning care. Transitioning care means you've decided to change from one insurance company to another. And some people don't like to do that because it can look like a daunting task, but I can assure you it is not. Canopy Health Net Care is here to help you every step of the way. I'm going to walk through what a transition of care might look like so that you feel prepared. And in this case, John and Mark have talked it over and they've decided to enroll their family in the Health Net CanopyCare plan for 2022. Before January 1st, John uses all of his refills that are available to him, and so he has his prescriptions ready and at hand before he makes the transition to his new insurance. Mark uses a CPAP machine, so he contacts his sleep equipment company to make sure that they take his new insurance. If they don't take the new insurance, they will help him get transitioned over to a new company so that there's no lapse in service. John has a complicated medical history, and so he asks his current doctor's office to transfer his medical records to his new primary care doctor. This means that John will need to sign a release of information document before those records can be released. This step ensures that the records are transferred in a very secure way. Mark, on the other hand, he doesn't have much of a medical history, so he decides not to transfer his medical records at all. One of their children is planning to have a surgery. So Mark and John apply for what is called continuity of care. Continuity of care allows people to continue with a surgeon or a service once they've transitioned under certain circumstances. Their child's case is reviewed by a Health Net clinician, that means a doctor and/or a nurse, look over the situation and decide the next best steps. Mark and John have decided they've got a few more questions about transition, so they reach out and contact Canopy Health's Care Ambassador program. One of the Care Ambassadors discusses all of their personal options and choices and provides them with personalized guidance to help that transition period. At the end of our story, Mark and John and their children have successfully transitioned their care. They haven't had a hassle, and they decide to make an appointment with their new primary care doctor before they get sick. And this allows them to establish a relationship so that John and Mark get to know the doctor and the doctor gets to know John and Mark. And together, a personalized plan of care for the family is established. So I hope this has given you a little idea of what your transition to Canopy Care might look like. Thank you.
Perfect. Thank you, Andrea. This really does paint a great picture of what a member's transition would be like, and really pointing to the fact that they're not going to be lost and fending for themselves, but there's quite a few resources along the way to help smooth that transition. Thank you. Next, we have Terry Esslinger to say a few words, including about the resources available on the HealthNet microsite.
Sure. Thank you, Cameron. This is Terry Esslinger. Thank you for joining us today, everyone. We appreciate you taking the time to be here. We know that choosing the right health plan that fits your needs or the needs of your family is really an important decision. And we're happy to have you here. If you'd like to learn more information about the CanopyCare HMO plan, you can visit our custom microsite that's there on the screen, healthnet.com/SFHSS. And you know, we've really created this custom microsite for you. It's a place you can go to search for providers in the Canopy Health Network. You can access the CanopyCare HMO plan details. You have access to our member guide, or you can review it on the site. And I'm so sorry that it's loud here in the background. You can learn how to register on the MyCanopyHealth portal. You can find helpful information about our wellness programs and discounts. We have discounts on things such as gym memberships, discounts on weight management, massage therapy, and so much more. You can also learn about our pharmacy mail order program and how to find information on continuity of care. In addition to the microsite, you can also reach out to HealthNet's dedicated SFHSS Customer Contact Center. I'll put the telephone number in the chat. It's 833-448-2042, and the reps on that phone are dedicated to San Francisco, very familiar with your plans, and are ready and available to help you. I would also encourage each of you, if interested, to take advantage of the office hour appointments that are available to you. They're available to all SFHSS active employees and early retirees during open enrollment. You can find the link in our office hours appointments on our custom microsite and also on the SFHSS OE website. And we'll also include that in the chat for you. I know you've learned, and we've shared a lot of great information today about the CanopyCare HMO plan, the Alliance Referral Program, how to access care. But we are here and happy to answer any questions you have, and really look forward to the opportunity to serve as your health plan partner of choice in the upcoming year. So thank you for joining us today.
Terry, thank you so much. While folks are thinking of questions to ask in the chat, I'm going to hand it back to Jessica to talk about some great fun raffle prizes and how to get them.
Yeah, so we want to thank everyone for joining. We are about to have our live Q&A very soon, and I see that you have asked a lot of really awesome questions, so we can't wait to get to that. But in the meantime, we have a raffle prize drawing for all of our attendees. We want to thank you for attending our webinar, so please feel free to enter the raffle drawing, and if someone can throw that link into the chat, that would be greatly appreciated. I am now going to go down the list to all of the wonderful questions that you've asked. So I hope thank you all the presenters, and I hope you're ready to answer some questions. Hello, is there an out-of-pocket maximum on this plan? So yes, there is. For individuals, it's $2,000, and for families, it is $4,000. The next question is, how do you find a CanopyCare HMO? Oh, how do you choose a PCP doctor? So I put a link in there, and that's where you can find providers. Is there another way? I don't know if somebody from CanopyCare can answer this. For someone to choose a PCP provider.
So I'll take that one. This is Andrea. You can look on our website and sort by geography or look for a name you might have heard from your family or friends. But I encourage you to talk to those who know, and who you trust, and then go to the website, and I'll bet you'll find those providers.
That is a great recommendation. Thank you so much for that. And the next question is Stanford included? So Marissa, thank you for answering that. So Stanford, unfortunately, is not included in Canopy Health Network. The next question is healthcare available in Sacramento, California? Does someone want to take that one?
Sure, this is Cameron, I can take it. So currently our service region is the Bay Area, so really just the main counties in the Bay Area. That said, if someone is traveling to Sacramento and they have an emergency, they are permitted to go to the emergency room. Terry, is that right? The plan covers, of course, out of area emergency room visits.
That is correct.
And urgent care as well, is that correct?
It's emergency and urgent care services, correct.
Great, thank you. And the next question is, what is the, actually, could you, because I see that Marissa typed in the 9 Bay Area counties, and they are San Francisco, Contra Costa, Alameda, Marin, San Mateo, Santa Clara, Solano, Sonoma, and Santa Cruz counties. So that is where CanopyCare has their great network of providers and hospital facilities. The next question is, what is the copay for appointments and prescription medication? Terry, could you read that answer out loud for all of our members?
Absolutely. So the office visit copay for whether it be a PCP or a specialist is $25. For prescription drugs, there's 3 tiers plus a specialty tier. Under tier 1, it's primarily generic. The retail copay is $10. Tier 2, which is your brand or preferred, is $25, and then tier 3, which is non-formulary drugs, is $50. Specialty tier drugs are covered with a 20% copay and a maximum of $100 per prescription, meaning that's the most the member would have to pay for that. And I just also wanted to point out that for maintenance medications, we do also offer a mail order program.
Thank you. And the next question, do you still need a referral from your PCPs to see a specialist such as a dermatologist?
Andrea, would you mind taking that?
Not a problem. You need a referral. What's different about the Alliance referral program is that is automatically approved when you're identified as a Canopy member.
And so that means they can see a dermatologist even outside of their PCP's medical group. Is that correct?
That's correct. If you happen to live in Costa County, but you want to see a dermatologist in San Francisco, close to where you work, you can do that. And that medical necessity bar has been removed. You can do it simply because you want to.
And for those who have experienced attempting to get referrals outside of their medical group with other health plans, it's you'll know how difficult it is. There really are quite a few hoops to jump through, and ultimately an exception has to be made. And so the main takeaway here is that what for many other health plans is an exception is actually a feature for us, and it's something we enable our members to do.
Thank you. Now, the next question is, some HMOs are dependent upon specific zip codes or mileage radius. Does CanopyCare have this requirement?
Mike, do you know you or anybody else can respond to that?
Yeah, happy to take that. So as was outlined earlier, we participate in the 9 Bay Area counties, but specifically to this question, yes. There's a whole regulatory process where we have to file our zip code service areas with the Department of Managed Health Care. A member can participate with Canopy if they live in the service area or if they live outside but work in the service area. And if you want to follow up your note with a specific zip code, we can follow up with you afterwards to confirm that you live in the Canopy Health Service area.
Great. And so you can always schedule a one-on-one consultation with Canopy Health, and you can find that on our open enrollment website. You can find a link there. And the next question is, what qualifies a patient to receive acupuncture? Is that an Andrea question?
Yes, it is.
Sure, I'm happy to take that. Acupuncture is available to treat a variety of pain syndromes, as well as it's symptom management in a very general way. It is not. It is not a very. It's a broad benefit rather than a narrow specific one.
Are there any qualifications?
I think what I would add, this is Terry, and what I would add is that, acupuncture services under the plan are covered through HealthNet's partner, American Specialty Health. And members do not have to seek a referral from their primary care physician for that service. They can contact American Specialty Health directly. Okay.
So I think to answer the member's question, if you want to go see an acupuncturist, you can. Is that correct?
That is correct. And there are 30 visits allowed per year for acupuncture and 30 for chiro, and they're $15 copays.
Great. Thank you so much for clarifying that. The next question, what is the main differences between Canopy Health and Kaiser Permanente?
So this is Cameron, and I think Mike and I can tag team this, but I would say the big difference is the access to the health systems and hospitals. So we've mentioned UCSF and John Muir, and when you look at a list of the top hospitals in the Bay Area, you'll often find that some of those top hospitals are Canopy Health Alliance Network hospitals. So just starting off with quality, and then Mike, is there anything you'd like to add?
Yeah, I would say that Kaiser Permanente is a staff model HMO, which means that the physicians and other healthcare professionals who support that plan work for that health system. So it's a very different model, certainly a successful one in Northern California. But to Cameron's point, there's really no overlap between our network and the Kaiser network.
Great, thank you. The next question is, how much is the biweekly deduction from payroll for more than 3 family members for coverage? And so we really recommend that you go on to SFHSS.org/OE 2022, select the employer group that you are with, and look up the rates sheet, because it really depends on which group you're with and your union. And so we have all of the rates listed online. And hopefully you also received our mailer with your booklet, and that will also tell you what the rates are. The next question is there a deductible? And the answer is no, there are no deductibles. The question after that, I saw the John Muir Center near me has hours 8 a.m. to 5 p.m. Where would I get urgent care after hours? Also, the nearest Canopy Care Hospital ER to me is 40-minute drive. What if I need to go to the ER?
Andrea,
I can jump in. I'll jump in and take that one. First off, I would encourage you to look past the John Muir office that has hours of 8 to 5. My guess is that if you look closely at our network directory, you'll find other urgent cares that provide after-hours care. Regarding the need to get emergency services, obviously, if you have an emergency, you are free to go to wherever you need to get care, whether it's in the network or outside the network.
Great, thank you. And the next question is, do all physicians at your care facilities accept CanopyCare?
The answer is yes. So I think what you're probably referring to are surprise billing situations that sometimes involve radiology, anesthesiology, and pathology. That is not an issue with the Canopy Health Network. Those services are covered under the plan.
Great. And then the next question, so I thought United Healthcare was a PPO and not HMO, so that you are actually correct. So this is the HealthNet CanopyCare HMO presentation, and United Healthcare has a Medicare PPO plan with SFHSS. But if you're an early retiree or an active employee, you can certainly consider CanopyCare as a plan for next year. The next question is, what is the relationship between CanopyCare and HealthNet?
Yeah, I'll take that one. Think of us along the lines, you've seen the TV commercials about Intel Inside. So you have your computer, and then inside the computer is the chip, the thing that drives the computer. A similar analogy would be with the CanopyCare product. So CanopyCare is a product of HealthNet, and Canopy Health serves as the chip inside, if you will. We manage the network and arrange for the provision of healthcare services.
Great, thank you. And the next question, can you carry CanopyCare into retirement, or is it only for active employees? So currently, CanopyCare is only for active employees and early retirees. We do not have a Medicare plan with CanopyCare. The next question is similar to the user with the ER question that is far away. What if you are out of state? Is out of network available? Does it work the same regardless of location? Does out of pockets apply? Is there a percent responsible before and after out of pocket maximum? Terry, I saw you answer that one. Could you read your answer out loud?
Absolutely. So you are definitely covered for emergency and urgent care services really anywhere worldwide. In some instances, members may be required to pay up front for services and then seek reimbursement through us, the health plan. If you're planning a trip, though, I would encourage members, if you're enrolled in our plan, to call the customer contact center, and they can provide you with a travel kit that will actually really outlines for you what to do in the case of an emergency. There's a claim form and such in there. And then, you know, if you do have to pay for services out of pocket, you'll be reimbursed by us, and then whatever your co-pays or co-insurance are for that service would apply to your out-of-pocket maximum.
Thank you, Terry. Now, how often does CanopyCare eliminate a facility from your list?
Well, in light of noise in the Bay Area recently with a major health plan and provider split, I can see why this would be a top of mind for some people. We have not ever in our history dropped a provider from our network, and I think that speaks to the unique relationship. Because we are owned and operated by healthcare providers, we have a different sort of relationship. We don't tend to have the same tense and difficult negotiations that other health plans might.
Thank you. And is Canopy Health available to retired members with Medicare? So unfortunately, it's only available for early retirees and active employees at this time. And does the next question is, does the MHN app integrate with Psychology Today?
Jesse?
Hi there, Jesse. We don't really have a specific MHN app at this time. We do have the ability to do provider searches on the website, but an app is something that we're working toward, but at this point we don't have that.
Okay, great. And then if you need to seek medical care while traveling out of state, will you go to the nearest facility and file a claim for reimbursement? Terry?
Yes, that is correct. So we do want you to seek care at the nearest medical facility, and then if you are required to pay out of pocket for those services, then come to the plan for reimbursement.
So when you say that, Terry, just to clarify for our members, if it's within the United States and they show their Health Net CanopyCare HMO card, will they generally not have to pay out of pocket? Is that out of pocket mostly for overseas, or does that also happen in the United States?
It really depends on the provider, Jessica. I think that you will see times definitely, maybe within California, you're less likely to be billed for the whole services, but out of state, I would say that there's a good chance that you may be required to pay for services and then seek reimbursement. Some of the hospitals are more flexible and will bill the health plan directly.
Okay. Okay, so it really is case by case. Thank you so much for clarifying. The next question, SF General Hospital has a brand new birthing center, and with the new building, with this plan, would my family have access to using those rooms? Is that an Andrea question?
You absolutely do have the ability to access that beautiful new birthing center. Yes, indeed.
Wonderful, and it is one of the reasons why we have partnered with Health Net CanopyCare HMO and wanted to provide this new HMO plan for all of our HSS members. Okay, the next question is, what is the IVF coverage? Is there coverage for IVF medications? Does somebody know about pharmacy?
I can speak to that. I know the fertility treatment benefit well. So the IVF is definitely covered. I believe there are 2 IVF cycles in the benefit, and the injectable medications that go along with that are also covered at 50%.
Okay, great. And the next one is pretty much similar. So do fertility meds require prior authorizations, and how long could this take? And is only 50% covered, or does it qualify under a prescription tier system?
So infertility related drugs are covered under the medical benefit at 50%. Health Net reviews those, and the turnaround time, or the time between asking and getting a decision, is 48 hours.
Great, thank you. And how does the out-of-network visit work? Is it available out of California? So Mike, I saw that you answered that earlier. Could you read the answer out loud for all of our members?
Sure, Jessica. Coverage for emergency and urgent care is available outside the CanopyCare service area, so both other parts of California and outside the state. And Terry reviewed earlier the process for getting a claim paid if, in fact, the facility requires you to pay up front.
Great. And what is the average turnaround time for referrals?
So the average turnaround time for referrals depends on what the referral is for. Generally, for routine sorts of care, it's 48 hours. For urgent, it's same day.
Thank you. And our next member asked if this presentation will be recorded. Yes, it will. If you go back to our OE landing page, you will see our calendar, and if you click on today's date and this presentation, you will see the video uploaded. We're going to try to upload it later this evening, so please check back. The next question is, what is required to qualify for massage therapy?
Terry?
Sure, and I made mention to that. So that is actually a discount program that is offered as part of your enrollment in our plan. So there's nothing you have to do. You just have to actually reach out to one of the massage therapists available in the network, and you will let them know that you're a Health Net CanopyCare HMO member, and you will receive their discount.
Thank you. And the next question is, do you know the differences between Canopy Care and Blue Shield Access Plus? Are there providers and or hospitals that are included by one and not the other?
So if there is a specific, I would encourage the member or the person who asked this to refer to the website, the SFHSS website, where the network constituent networks are included and there's a side-by-side that they can look at. So it really would depend on what hospital or medical group that this individual is interested in.
Okay, and the next question is, are Sutter Health physicians within this network?
So the short answer is no, Sutter Health is not included in this network.
Thank you. And the next question, when out of town, any urgent care and ER is covered, is that correct?
Terry?
Yes, so urgently needed services and emergency visits are covered.
Thank you. And how many acupuncture and chiropractic visits are allowed per year?
And I was
Terry,
just typing an answer to the chat in the chat for that, so I'll include it. But you may access 30 visits per year each for chiropractic and acupuncture services. Again, it's a $15 copay, and Health Net partners with American Specialty Health to provide the services.
Thank you. And the next question, are Sutter Health and Palo Alto Medical Foundation physicians included in this medical group?
So no, Palo Alto Medical Foundation is excluded. That's part of the Sutter network. And as stated earlier, Sutter Health is excluded from this network.
Thanks. And the next question, what is the coverage for fertility treatments? Is blood work, etc. included? Is that an Andrea question again?
Maybe Terry or Andrea. Terry, it's I guess it's not asking. They're not asking about prices. So Andrea,
Sure. Fertility treatment is covered at 50%, and any blood work or x-rays, any testing related to that care is also covered.
Thank you. And, you know, we have a lot of questions about acupuncture and chiropractic care as well as fertility. So is there a referral needed for acupuncture and chiropractic care? Terry?
Yeah, the answer to that is no. There's no referral needed. Members can contact American Specialty Health directly. And again, it's 30 visits each for chiropractic and acupuncture.
Great, thank you. And our member also wants to know if you can say more about massage coverage.
Yeah, so let me see if I can get that up in front of me quickly. I apologize that I didn't have that up in front of me, but it is a discount program. It's also offered through American Specialty Health, and it allows you to seek massage services through their vendors at up to a 30% discount over their normal rates.
Thank you. And what is the difference between Canopy Health and Blue Shield Access Plus HMO coverage? Our member feels they look very similar.
Mike?
Yeah, so what I would say is, and Jessica, I think you can confirm this, in terms of benefit coverage, pretty close to identical. The differences would be in the network configuration. Canopy Health network is different than the Access Plus network. You'll need to look at the comparison that Cameron referenced earlier to see those differences. And then I would point to something we talked about earlier. I can't speak for the Access Plus plan, but most HMOs do not give you the flexibility to get specialty referrals outside of your primary care physician's medical group. As Cameron said, with the Canopy Health Network, that's a feature. It's something we're proud of, and you have that flexibility with us.
Great, thank you. And the next question, how are you defining early retiree? So at SFHSS, we define early retiree as non-Medicare eligible. So we realize maybe you're no longer an active employee and you've actually retired. An early retiree is just one that is not yet Medicare eligible. And the next question is, if no current retiree plan, is or will there be a retiree plan offered at some point in the future? You know, I don't have a crystal ball, but we are always looking to improve our offerings. So it is up to the leadership team and our board to determine that in the future. Thank you so much for that question. And next member asked, I did hear this, if I heard this question correctly, you do not need a referral to see a specialist out of the medical group. I don't think that's quite right. Can somebody explain how referrals work?
Hey, Jessica, let me jump in and help with this question. You do need a referral, but what we're saying is we're not going to make you jump through a bunch of hoops. The primary purpose for the referral is to make sure that your primary care physician helps you with the course of treatment and is aware of where you're getting your specialty care. So he or she have a full view of your health situation.
Thank you. The next question is, you mentioned copays for doctor visits are $25. Are wellness care exams and screenings such as mammograms and colonoscopies free?
And that is correct. Yes, they are. So preventive services are covered with no copay.
Thank you. And what Contra Costa hospital and medical centers are included in CanopyCare?
Yeah, John Muir Health has 2 campuses, Concord and Walnut Creek, as well as a number of ambulatory centers. I believe they are in Orinda. Let me guess, there's another one in Concord, another one in Walnut Creek, and there's one in Pleasanton and San Ramon, so good coverage there. And then San Ramon Regional Medical Center is also part of the Canopy Health Network.
Okay, thank you. And the next question, it's the members asking, can you please repeat the part about not covering radiology, pathology, anesthesiology when seeking emergency care out of network?
I'm assuming this is a reference to a previous response given. Is that right?
I don't remember us talking about radiology.
Nor do I. So,
but could you just ask if somebody's out of network, let's say they went to a hospital in a different state or country for that matter, and they needed, which means that only emergency services are covered. If, let's say, radiology, pathology, or any one of those, is it covered?
The short answer is yes. If it is in the course of emergency treatment, say you fall and break your arm and need an x-ray to prove that or to help get it back in place, that is absolutely part of your care and is covered.
Okay, are there situations where it would not be covered in an emergency situation?
Emergency care and urgent care are always covered.
Okay. But if you just want to, let's say, if you just want to go out of state to get one of those things covered, then it would not be covered.
That's correct.
Okay. I hope that clarifies it for you, for our member. Yeah, if you're perfectly healthy and you, let's say, sought treatment at Cleveland Clinic just for shocks, that would not be covered. But if you had an emergency and you were next to Cleveland Clinic and you needed the service, it would be covered. Okay, next question. Do all your docs offer video call appointments via your mobile app?
Yeah, I'll jump in and take that one. I would think about video visits in 2 ways. One is if you need an after-hours urgent video visit, you can do so through the Canopy Health, MyCanopyHealth app. Separately from that, many physician offices today are doing video visits. I had one last week with my specialist. They all tend to have their own setup. They may text you a link. They may ask you to go to a specific website. there's a whole variety of ways that they're supporting telehealth. And so you may have different access points. And I would say follow your doctor's lead unless it's an after-hours visit, and then you do it through the Canopy Health site.
Great. So we only have 3 more questions. I know we're at time, but if it's okay, I'd love to just get them all answered. So is Walgreens covered as one of your pharmacies? If not, will they be covered at some point?
And yes, they are in our network.
Wonderful. And how long has CanopyCare been in existence?
Mike?
So Canopy Health has been around since 2015. CanopyCare is a new plan that was created with HealthNet last year. So relatively new, although we've worked with HealthNet on other plan offerings for many years, since 2016. And the other thing I would point to that Cameron mentioned earlier is many of the physicians, nurses, and other healthcare professionals across our network participate in Canopy-based plans. So UCSF, John Muir Health, Marin Health, Sonoma Valley Hospital, Hill Physicians all offer Canopy-based benefit plans.
Great, thank you. And the last question, yay, if you get a referral to a specialist or doctor out of network, what is the cost? Is it the same copay as in network? How is this different from a PPO? So could you explain how that all works?
Mike?
Well, yeah, what I would say is it's highly unlikely that you're going to get a referral outside the network. When you recognize that we have the esteemed physicians at UCSF in our network, I think we have pretty much anything covered. But if there was an unusual circumstances where it is approved, it would be covered just like any other benefit.
Yeah.
But I want to reset the expectation. It's highly unlikely that you'd get a referral outside the network.
Yeah, and to clarify for our member, because just in case this is the situation, so there is such a thing as outside of your medical group, which historically for a traditional HMO plan is considered out of your network, but it is as long as they are a CanopyCare provider, that's actually all considered in network. Am I saying that right?
That's correct.
Yes. Okay, so that is all the questions we have. Thank you everyone for participating today. We really, really love the amazing questions. We have 51 published, so that's quite something that we were able to get through so many. Thank you for joining. Please enter our raffle prize drawing. We really appreciate you attending today and learning more. And we hope you'll consider this new health plan, Health Net CanopyCare HMO, when you go to register for your benefits using eBenefits. Thanks so much, everyone, and have a great afternoon.
Thank you.
Thanks, everyone.
Thank you.
Bye.